Morning, runners, friends, and relentless seekers of clarity and health. Welcome back to Amy on the Run. Today we're diving into something that every endurance athlete needs but often overlooks, and that is alignment. So not just in our stride, but in our recovery, resilience, and even mindset. I am joined by a certified athletic chiropractor who specializes in helping runners like us go the distance safely, powerfully, and with less pain. Let's uncover what your spine, posture, and breath are trying to tell you and why alignment is more than physical. It's personal. So let's go. So this is Dr.
David Miller. I've been a chiropractor for almost 30 years now. I've also taught at the university level, and I've held certifications in chiropractic sports physician, American Council on Exercise, and I've been through many seminars, postgraduate seminars in this field here. So it's good to be here today, Amy. Thanks for inviting me.
So I'm really excited about having our specialist here today because Dr. Miller, because the specialty for athletics in chiropractic has been hard to find. I have lots of friends that are chiropractors. One of my neighbors is a chiropractor. Even one of my closest friends' husband is a chiropractor. And when I ask them if they specialize in athletic chiropractic, the answer is always no, that's a specialty and that's not something they specialize in. So I'm very excited to have a specialist here, especially on our Runners blog. So tell me, what inspired you to specialize in chiropractic, athletic chiropractic care?
Well, when I first started out almost 30 years ago, a lot of the patients that I was seeing were recreational runners. I had high school athletes, some college athletes. They just kind of gravitated towards that. It really was a move to get people active. Because let's face it, this country, we are a very sedentary country. If you look at the CDC statistics and everything, only about 22% of the people get adequate exercise. That's like 1 out of 5. And that's really distressing. So I wanted to work with a lot of the people that were interested in getting active and staying active because it boils down to the health of our country after all. It's that important. There's a lot of misinformation out there also. Everybody has an opinion on things. And so it's kind of a way of giving back to people that really want to be healthy. And chiropractic has always been the leader in, say, healthcare, not just disease care. We just don't want to fix things after they happen. That's like emergency room medicine. What we really want to do is performance care, maintenance care, getting somebody and maintaining that health span that everybody's starting to talk about now, rather than just, oh, I can live long. Well, yes, you can live long, but you can live long sicker, which is what's happening in our country. So that's what kind of drove me into seeing the athletes, because they were motivated and they would listen to you and maintain that healthy lifestyle.
Yes, it really means something. So tell me how your certification differs from a traditional chiropractic practice.
Well, there are a lot of similarities because everybody has a nervous system, everybody has a musculoskeletal system, but there's different needs for that athletic population. There's different stresses, additional stresses, rather than just sitting on the couch watching TV. So in order to treat this population, you have to know a little bit more about how the musculoskeletal system works, what you need to do to maintain it, what does nutrition have to do with it, other lifestyle things like sleep hygiene, which everybody kind of forgets about now. So it takes a little bit additional education to go after that knowledge, to be able to deal with these, because there's a lot of motivations behind people and why they run also. And sometimes it's dealing with the psychological aspects or the social aspects, or, you may have eating disorders, or there's a lot of things that play into this. And depending on your age group also, depending on if you deal with elite college athletes or you dealing with masters runners over 85, they have different needs. And you kind of have to be able to tell them truthfully, what they need to do. It takes a little bit of nuance to do that rather than just general chiropractic.
So, can you share a transformative moment with an athlete or a runner that affirmed your path?
There was a number of them in my past. I was thinking back over this over my 30 years here, and it's amazing how many lives you actually do touch when you think back on it. You don't think so at the time, but then they come back later and tell you about it. There was a number of them because I've dealt with a lot of adolescents and kids, like the cross-country runners and everything. A lot of them have a lot of structural issues, especially when they're growing in adolescence and everything, and things are changing a lot. Women going through menopause, there's a lot of changes musculoskeletally there. Pregnancies, there's a lot of changes there. You have to kind of recognize that these patterns that emerge, there's very similar patterns that emerge no matter who it is. And to see the magic happen when you treat people, I mean, I guess you kind of get numb to it sometimes also when you kind of see this day after day. But to them, it's like, I thought I could never run again, or I thought I could never get out of bed again or anything. And it's happened so many times that it's like, I don't know if I could pick one real great one out, but there's been quite a few that never thought they'd work again, never thought they'd be able to run.
Well, I know after my mother had her stroke, we didn't know if she was going to be able to do any substantial walking again.
Right.
And it was surprising how once we started working with her, that just the consistency of getting her to walk and to, do regular exercises, participate in physical therapy, those kinds of things were really able to help push her along.
And one thing I've always had to remember is never prejudge anybody. You may think that, well, I can never help this person, but lo and behold, they respond beautifully to whatever you do. So I've refrained from prejudging anything that's anybody comes in with. So you can always make strides with somebody no matter where they are in their journey.
And that is the key. So what are the most common injuries or misalignments that you see in distance runners? Because that's where I am. I consider myself a middle distance runner in that I do 5Ks and 10Ks.
Okay.
And I do have aspirations to do a 15K, but that's about as far as feel like I'm going to push it.
Okay. Distance running involves a lot of lower body mechanics. So if you look at the literature and the most common injuries that we see, it's knees, feet, ankles, hips. A lot of the pelvic alignment is the key issue, though, because the pelvis, right between your pelvis and your belly button is your center of gravity. So everything revolves around your center of gravity. So think about it as the front end of your car and the tires. So if they're in alignment, you can drive tens of thousands of miles on them without any problem. If the alignment is off, you can still ride on those, but you're going to start to notice some weird wear patterns that start to happen. If the alignment is off in us somehow, whether it's pelvis, hips, knees, ankles, spine, whatever it is, there's going to be a consequence to that. There's going to be an adaptation to that somewhere. It's just physics. We can't get away from it. So, which is why the pelvis, the spine, and the knees are some of the biggest injury rates are in that area.
Well, it's interesting that you would bring up the pelvis because I have been struggling this season with a hip injury that I have just been nursing along where I can run and then I can't run and then I can run. And so it's interesting that you would bring that up. So tell me, how does chiropractic care complement endurance training and long runs?
Well, endurance riding is kind of unique because it's a length of time. You're not doing this for like 10 seconds. So any misalignment that you're going to have is going to be magnified over time. It's kind of like the pebble in your shoe. If you have that little pebble in your shoe and I tell you to walk 5 feet, you could probably do it without much of a problem. But if I told you to go run 10 miles with that pebble in your shoe, you probably wouldn't be able to maintain that. So structural misalignments are going to be magnified over the long run when you're doing endurance training, which is why evaluating those and treating those imbalances is going to be critical in the long run, because parts start to wear out. We replace a lot of knees. We replace a lot of hips in this country. They do a lot of surgeries. Knee problems are usually never just knee problems. There's a hip involvement to them. Most of the hip radiation is down to the knee. Sometimes they'll just complain of knee problems, but it's not the knee problem. Sometimes they have problems squatting. The number one reason why people go into assisted living is they can't squat.
Really?
Yep.
I didn't know that.
So if the squatting mechanism is not correct, okay, the hips, the low back, and the sacrum, that's part of the tailbone, are going to have to adapt. And you either get sacroiliac pain or hip pain or knee pain or low back pain. It's going somewhere in the chain. It all starts with the feet, because the feet are your foundation.
Right.
So if you're
and we runners love shoes. Just so you know.
What was that?
I said we runners love shoes.
You do love shoes.
Yeah, so go ahead.
But it's not so much the shoes, it's the feet that go into the shoes is the issue. Because if you pronate on one side, that's going to rotate your knee internally, bring the hip forward, which is going to tilt the pelvis towards that side. Your back has to, you can see how this corrects all the way up to your head, your neck.
Okay.
If one thing that we've learned in chiropractic is everything's connected. You can't change one thing without something else adapting to it. That's just the way we are.
Okay, so are there signs runners should look for that suggest they're out of alignment?
A great thing to do is a mirror.
Really?
Look at your posture in the mirror from the front, and then have somebody take like a picture on their phone from the side, just standing there. And you can tell if there's sideways kind of deviations, or you have a forward head posture where the head comes forward, or the pelvis comes forward, or both the head and the pelvis come forward, like a sway back kind of posture. Your body is going to have to expend additional energy with those abnormal postures, because muscles are trying to maintain that, but that requires energy. So it's going to suck the energy out of you that you might need for going faster, longer kind of thing.
Right.
That's where those adaptations come in. Also, if you have these little nagging pains that show up in the same areas all the time, that's probably an indication that that area is probably adapting for something.
Okay.
And there's a misalignment. So looking at postures, taking pictures, now we have phones, which is great. They even have little apps to do postural alignment kind of things these days. Those nagging injuries, sometimes you can actually feel tender points, trigger points in muscles of the leg. It's hard to get to some of them on the back. But those are the kind of telltale signs. What's the person's posture? How do they move?
That is,
Are you having difficulty squatting on one side? Can you lunge correctly on each side? If you start noticing that, there's probably some adaptations going on within inside of you.
Well, I noticed after I came back from my foot surgery, I was leaning to one side, and I wonder if that contributed to my hip.
Anytime you have surgeries or you're on crutches or you have something for a long period of time, your body's going to be completely off.
Right.
You can't account for that. It's just going to happen.
So you have to really practice on it.
Practice too, and it's rehabbing that area correctly also, because with disuse, you get atrophy.
Right.
Which is part of the problem with the older population is what they call sarcopenia, where your muscle actually reduces in size and strength. One of the things that exercise does is to maintain that muscle mass, which is one of the biomarkers of aging.
Right.
Okay.
So, well, that takes us into the preventative and holistic health part of this conversation. So, how do you approach injury prevention from a chiropractic's perspective?
Number one, we're looking at the structure. What does the person look like? What do they feel like? How do they move? Look at their plan about what they're actually doing right now. People say that, I can squat just fine, but when you actually look at them, they're like completely shifting over one way when they're coming up. So our brains can't necessarily tell real well what's going on in the rest of our body unless somebody else is looking at that.
Right.
And we like to lie to ourselves too all the time. I get that.
Yeah, I thought I was doing great until Braxton started. Braxton is my coach.
Yeah.
And yeah, he started telling me my posture, my, all that
Correct.
stuff. Yeah.
But it's stuff that we need to
Strength
know,
training.
because otherwise, if you don't know the information, you can't change it.
Right.
You will never be able to change. And that's the kind of the key point here too.
So carrying forward with the posture, what role does posture play during running and daily life, play in overall performance? Whether it's just walking, running, playing pickleball is a popular one right now.
Yes. Well, we kind of alluded to it before, because when you're looking at the structure and you have those adaptations, it's going to increase the energy expenditure from that. It's also going to stress kind of abnormally or more tendons, ligaments, musculature, again, day after day, minute after minute also. Those tissues, if they're overloaded, are going to have to adapt somehow too. You either break down or you build up.
Right.
In order to not be breaking down, you don't want to have an excess of stress on that tendon all the time, because really the body's adaptation to that is fibrosis. It lays down scar tissue.
Right.
That's all it does. Lack of oxygen, abnormal tensions, cutting it, trauma, any of those things, you're going to get fibrosis in the end. That is going to limit your range of motion.
Okay.
So now that's an adaptation that kind of gets continued forward, and you get less and less and less range of motion over time. That is going to hinder your performance.
Right.
If you can't move, if I can't lift my arm past here, there's no way I'm going to do overhead activities or overhead presses or anything like that. So that is something that you want to look at also, which you may have to do some soft tissue.
Yeah, because my
work
next
with them.
question was, do you integrate other modalities like soft tissue work, mobile exercises, or breath work into your care? So
Definitely we do. You can't do everything by just a physical adjustment. Soft tissue fibrosis needs to be broken by hand or some other mechanical method.
right.
There's all different techniques out there. They all are kind of doing the same thing. Freeing up those adhesions, getting that pain-free range of motion back. That's what we want, pain-free range of motion. If you have pain, your body is going to adapt to it. That's just a rule of rehab. Laser, I use laser sometimes here. I have a class 4 laser. If there's a really acute kind of situation going on.
So what does the laser do? I mean, that's kind of new.
Laser's been around for quite a while. It's actually the veterinarians that started using it back in the 60s and 70s, and then it kind of moves over into the human realm. So if you want to know about anything, just ask veterinarians, because they did it first. But I have a class 4 laser, which means it's a higher powered laser. So laser is light, basically.
Right.
So it's easy, it's quick, and it can penetrate inside the body a couple inches, where most therapies can't do that. They're just basically on the surface. So basically laser, what it does to traumatize tissue is it kind of turns on that healing process a little bit faster. They've also used it in scar tissue, preventing scar tissue formation, like surgical incision wounds and all kinds of applications now. They got some fantastic laser things going on. I've had it for almost probably 20 years now.
Wow, that's great. Very interesting.
The other thing is the mobility exercises and the rehab. Because I can't do it all in the office. You have to do some of it at home.
Yes.
So it's like, if you're not doing it, it's like, well, that's probably not going to work.
Right. And
But they have to know the correct ones to do, because they can do all kinds of things at home.
Right.
And then they come in and say, I'm hurting worse. It's like, okay, show me what you were doing. And they're like, I never showed you that.
Yeah. Well, I guess that's one of the advantages of working with athletes. Most of the time, the athlete...
They're pretty motivated.
Yeah,
You tell them to do anything. I tell them to eat nails, they'll do it.
And not only do they want to do it, they want to do it right, because they want to get back out there.
Correct.
I know after my surgery, the physical therapist had to really rein me in, because I was ready, as soon as I was able to walk, I wanted to start running. And he was like, nay, 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 nay.
Too much too soon. That's the old adage there.
Yeah, that was funny. So behind the scenes and strategy here, what does typical assessment or session look like for an endurance athlete? So let's just say, okay, so I saw our video here today, and I'm thinking, well, I really want to go and see this guy. So tell me, when I call you up, I make an appointment, what does a typical assessment look like for my first session?
Easy outline here. I take an in-depth history because most of your decision-making comes from a history. If you do a good history, which we've kind of lost these days, but that's a whole nother podcast. I do a targeted physical assessment, which includes kind of a movement screen to say, okay, where are we breaking down in this whole scheme? And what are we, because the assessment basically is going to be your plan.
Right.
That's what you're going to target. There are other things that you want to look at in this person too, though, other than just the structural things. What is their nutrition like? Because you can't exercise away a crummy diet.
This is true.
Okay. That's a big, big piece. How is their sleep? You cannot heal if you are not sleeping well.
Right.
This is not going to happen.
Wait, since you brought that up, I have a condition called short sleep syndrome. Have you ever heard of it?
Yes, I have.
Okay. So how does a person like me with short sleep syndrome heal properly?
It's a difficult thing. You know, we have an epidemic of insomnia and everything in this country, which we really don't talk about, but we're learning more and more about sleep. And that's when the healing takes place. Broken sleep, we know what that does to the brain. It doesn't do good things to the brain.
Right, right.
You can't function, you can't focus. That's when the brain takes out the garbage, is at night.
Mm-hmm.
So some of those kind of clinical situations can be really tricky to do. You try to do the best you can on setting up the best sleep hygiene that you can do for that person.
Right.
But that's one thing that they're going to have to kind of focus on, that because they know that that's going to definitely impact performance. Right. You don't sleep, you're not going to perform.
Right.
We know that.
And I have to work very hard to get 5 hours of sleep a night. I have to set everything up perfectly, do all the routines, that kind of stuff so that I can sleep.
And it was the military that came up with this whole study on like sleeping at least 5 hours. Mm-hmm. So the catecholamines of your brain, the adrenaline system recharges. Mm-hmm. If you don't get that 5 hours, it doesn't recharge. So they're good at sleep depriving people. So they did all the studies on this.
So can you walk us through what a personalized recovery plan might include or look like? Just a brief. I know that would be too long to actually get into a full.
Yeah, I'll just outline it. Okay. We're addressing the postural adaptations, either by adjusting or in addition to any rehab exercises or anything that person should be doing. I usually do a food diary with somebody too if I think there's going to be a problem nutritionally, because a lot of runners have a lot of nutritional issues.
Yes, colitis is huge.
And sometimes blood work. I will do blood work as was one of my main focuses down here when I came to South Carolina, was a program to answer the question basically, how do you know if you're healthy? Well, if you're not doing an assessment, what metric are you using to figure that out? Blood work is one of those things it's objective. It's black and white. Everybody knows what it is. All doctors know what it is. And it's something you can track over time. So a lot of people end up deficient in many different areas. I mean, if you're vegan, there's a set of issues that you have to look at. Women that are menstruating have a different set. Are they anemic? Can you make energy? Do you have hypoglycemia? Do you have hyperglycemia? All those should be part of that health program or recovery program. If not, you're kind of getting half the program. Yeah, you can send them back into after they've healed. But if they're not healthy, it's like they could be tearing themselves down again.
Sure. Okay. So wellness, philosophy, and mindset. So how does the mind-body connection factor into healing and alignment? I guess we kind of touched a little bit on that with the sleep and all of that.
We did. That mind-body kind of thing that they talk about now. I mean, it's not a new concept. They talked about it at Harvard in the 1920s.
Right.
We kind of forgot about it after a while, though. But our emotional, our psychological mindset is probably more important than our structural. Why are people doing what they're doing? What's the reason for their exercising? The mind has an incredible power. From that rehab seminar, they talked about a case where a guy stepped on one of those 6-inch nails, went through his boot. They had fentanyl and everything. They pulled it out. The guy was in excruciating pain. Every movement set him off. Well, guess what? When they took the nail out, they found that it didn't go through his foot. It went in between his toes. There was no injury, and yet it was an incredible pain.
Wow.
So the mind can have an incredible impact.
It's supposed to hurt, therefore it does.
Right.
Mm-hmm.
Exactly.
All in a name.
So it's that fear avoidance kind of thing when you get into injuries too. It's like, if I do this, I'm going to hurt. But that's not necessarily a bad thing all the time. You have to have the correct mindset on being able to recover and recover correctly and not be fear avoiding. Okay.
Okay. So do you see spiritual or emotional resilience show up in physical recovery?
I think both of those play in hugely. I mean, ask anybody why they exercise. A lot of it's going to be spiritual or emotional reasons for that.
Yes, I know that.
It's just kind of a side benefit to it, but it's never just the benefit.
Right.
If that was just the benefit, I could hate running and just do it for health.
Right.
But I don't think people would stay with it. They're not going to do things they hate. It's just what I've found over years of dealing with people's behavior. The people that really continue with this and do incredible ultras and all these kind of things, it's like you're not doing it just for health.
Right.
There's other reasons for this. You know, the endorphin system, you get a runner's high off of this. And you know, people want to maintain weight. People want to get away from traumatic PTSD. There's 1,000,001 reasons why people do this. And a lot of them are just emotional and psychological issues. And if you don't understand where they're coming from with those, you may miss out on how to treat them too.
Right.
If you just treat them structurally, they may get better, may not.
Right.
But you have to understand where they're coming from and why they're doing what they're doing. That's what we try to do now. We're understanding it's not just the body.
Okay. So, what's one piece of advice you'd give a runner training for their first marathon, which will never be me? I say that now, funny. Watch me do one in 20 years now. I'm just kidding.
I think the biggest thing for a marathon, which is an incredible distance.
Yes.
So there's an incredible stress on the body for this. So probably my biggest piece of advice would be preparation.
Okay.
Have realistic expectations and give yourself the time for your body to adapt to that.
So
structure has to be prepared for the insult that's to come.
Right. Okay.
So, there's all kinds of people that do it without any training whatsoever, but that's just kind of like a gimmick kind of thing. I don't think that's what people.
So can you help a runner with that plan?
Yeah, we take a look at their plans and what they're doing and seeing if it's a reasonable, if the goal is reasonable. Okay, because the last thing we want is to have them train or have a plan to train and they get injured.
Right.
And either they can't do it or they have a permanent injury from it.
Right.
If that's the case, what's the point?
Exactly. Okay. So if you could debunk one myth about chiropractic care, what would it be?
When people think about chiropractic, they think about spine or spine adjusting and everything. We're really not spinal doctors. We're nervous system doctors. Okay. When you're adjusting somebody, you're putting input into the brain and changing that person's whole physiology. So when you're treating somebody, it's not just, it's this joint that we're unlocking here. The body has a reason why that joint is locked. So you have to make sure that the nervous system is functioning correctly because it's controlling everything else in the body.
Right.
So you kind of have to have a different paradigm. We're not just interested in fixing boo-boos. That's our medical system. You patch them up, you spit them out.
Exactly.
It doesn't really work real well. It's very expensive, as you can tell. Health insurance hasn't gone down and it's probably never going down.
I know.
So the chiropractic paradigm has always been from the preventative care approach. Okay. Maintain a properly functioning nervous and musculoskeletal system to keep people out of trouble. Now, things are always going to happen. If somebody gets hit by a car or something, please take me to the hospital.
Exactly.
But that's a completely different thing. That's acute crisis management. We're good at that.
Yeah.
But chronic conditions, we're terrible at it.
Okay.
I think we are like 49th in the world on healthcare outcomes. And we spend 6 times as much money on this as any other country in the world.
Wow.
So is it the money or is what we're doing?
Exactly.
That's why we have to take a different approach. Otherwise, we're just going to get the same thing over and over again.
So, wow, that was powerful. I hope that you're walking away, not limping away, with your deeper insight into how your body's alignment fuels your endurance and mental clarity. So, if you felt something shift today, even just in your perspective, share this with a friend who needs a nudge towards healing. Subscribe for more movement, meaning, and motivation. Remember, long runs don't just strengthen your legs, they strengthen your life. Until next time, let's keep running with purpose. I'm going to include a link in the description section below called Wellness Navigator 3.0 to make it easier for you to reach out to Dr. Miller for your personalized session. So before I close this, just real quick, tell me about your Wellness Navigator 3.0.
This was the metabolic program that I referenced before to kind of answer the question, how do I know I'm healthy? So this is where I do my in-depth history, a physical exam, in-depth blood work, and then I create a unique plan for that person. It's a science evidence-based program here. It's giving people, where do I go and how do I start? Because my doctor says, well, I should lose weight or I should be healthier. It's like, well, okay, what do I do? Nobody knows what to do, and they don't know what their risks actually are.
Okay.
Because our primaries just don't run the blood work that's going to tell you that.
So it's a good place to start for the patient and for you.
Absolutely.
Okay. So I will put that in the section below. Just click on the www.wellnessnavigator3.0.com. So this is Amy and Dr. Miller with Amy on the Run. Thank you for joining us today. Let's go run.